Hi, Midhat Abdulreda from the University of Miami. You have been there since 2002 and worked with diabetes since 2007, and you are here in Stockholm now for a seminar. Can you tell me more about that?
Sure. Today's talk was basically a recap of our work in the last 10 years or so, demonstrating the unique utility of using eyelid transplantation in the anterior chamber of the eye in preclinical research to investigate diabetes, autoimmune responses against islets during type 1 diabetes development, as well as immune reactions against islets after eyelid transplantation to treat type 1 diabetes. And while I today covered various technical aspects of this platform in my talk, which was titled Transplantation in the Anterior Chamber of the Eye, a Powerful Platform to Study Immune Responses in Vivo, I did also cover various aspects of using this technique in the study of eyelid biology in general, and also the biology of other tissues other than eyelids. And I gave a few examples of that. But the main focus of my talk was basically a recap of our recent publication in Diabetologia, which reported on the use of the eye in the study of type 1 diabetes pathogenesis. In other words, the actual development of the disease, how it develops, and how the autoimmune reactions ensue against the pancreatic islets by using reporter islets in the eye, which are basically pancreatic islets transplanted, isolated pancreatic islets transplanted in the anterior chamber of the eye, which we showed evidence that they report with high fidelity on what's happening within the pancreas as this mouse model of type 1 diabetes develops towards becoming symptomatic. And I've also shown data demonstrating that with this model, we have a way to predict the disease before it occurs, before it becomes symptomatic, which is unfortunately would be too late for any type of intervention, because it becomes a lot more difficult to reverse the autoimmune process there. So with that, I was also able to, towards the end of my talk, hopefully convince you and the audience that all of these unique things we are doing with this application are also relevant to a clinical application. And I informed you and the audience, as you may have known, maybe not everybody in the audience, with the help of the Diabetes Research Institute Foundation and the Diabetes Wellness Foundation here in Sweden, with their help in funding a clinical trial that has been already approved by the FDA for us to evaluate the safety and the potential efficacy of transplanting pancreatic islets in the eye of patients with type 1 diabetes.
Mm-hmm. Thank you very much. Thank you.